Dr. Ali Jaffee, who's joined us here today on this IG Live, is a junior doctor with the NHS who has lived experience with clinical depression, panic disorder, and generalized anxiety disorder. She is an incredible friend and has a wealth of knowledge in medicine, mental and brain health, food as medicine, and so much more. She's the co-founder of NutriTank, and she's here with us to talk all about it. Before Dr. Jaffee breaks it down, please make sure to leave your questions about all we're going to speak upon in the comments on the live. We'll spend some time at the end trying to get to as many of your questions as possible. Leave your questions until the end, until we wrap up the questions. Hold your questions until then and keep them on the topics that we actually have discussed. Dr. Jaffee, can you begin by telling the audience a bit more about who you are and all you do?
Thank you for such a warm and just, wish it was in person, Kev. It was such a warm welcome. So, such a pleasure to be talking to you all tonight. I am a junior doctor. I've been practicing for 2 years. I guess in the States, you'd call me a resident. And I hope to pursue a career in psychiatry for as long as I can remember. Since I was a teenager, I've been hugely passionate about mental health and the mind. And so I also have my own lived experience of depression, and it's something we'll dive deeper into throughout the talk. And this is something that happened to me during medical school halfway through. And I am also a huge innovator and change maker, I'd say. It's a deep passion I have. And I started NutriTank when I was at medical school right at the beginning, because I saw a huge gap in the fact that we only practice with reactive medicine, very similar to the States, westernized healthcare system, and we don't practice with proactive medicine and actually empowering patients to take health into their own hands and teaching them about diet and lifestyle and teaching ourselves about diet and lifestyle, because actually healthcare professionals and the healthcare workforce are at great risk of burnout, and they don't know anything about diet and lifestyle, which is hugely worrying. So set out on that entrepreneurial journey quite early on in medical school. And so I like to refer to myself as doctor, patient, creative, and founder.
Doctor,
and that's
patient, creative, and founder, and even so much more, and fashionista. Yeah, let's
yeah.
about that.
Thank you for putting that in there.
Incredible.
Fashion is my passion.
Dr. Jaffee, can you tell us right now what is NutriTank? Break it down. Let's let the folks know about it and where they can learn more.
Absolutely. So NutriTank, it's all in the name. It's a think tank for nutrition and lifestyle medicine. And my co-founder and I, we met very early on in medical school, so about 10 years ago now, and we saw this huge gap, and we thought it was absolutely ridiculous that in our guidance for every chronic condition, from polycystic ovarian syndrome to diabetes to cardiovascular disease, first line management was offer your patients diet and lifestyle advice, and then you jump to the pharmacological intervention and the medications, and then if appropriate you jump to surgery. And we were sat there in our lectures thinking, well, we're trained to be doctors, but we've not come across any diet and lifestyle research that you are teaching us. And on the wards, and we were shadowing clinicians, we weren't witnessing any health coaching or behavior change conversations. So we realized it wasn't just a problem at our medical school, it was a systemic issue within westernized healthcare training, and we decided we wanted to make a difference and fill this gap. So we created NutriTank, which is a online community for like-minded healthcare professionals and students to learn more about nutrition and lifestyle medicine, not just for their patients but also for themselves, to prevent and manage chronic conditions. And so it's been a very exciting journey, definitely tumultuous at times and a bit of a roller coaster, as we know that a lot of founders have. And what's really interesting is founders are actually at an increased rate of burnout and mental health conditions compared to people in other jobs in the general population. And as a doctor, so I've got a double whammy in terms of risk factors, but we're on the other side, which is great. And so we're on a mission to really empower our healthcare workforce to talk about diet and lifestyle, and to really empower their patients to take health into their own hands, and to also lead by example, so that We can create better food environments in hospitals, and so doctors don't have to rely on having energy drinks and ultra processed foods on their night shifts. So we're really working with a lot of key stakeholders and other like-minded organizations to make this huge systemic change around education, but also the food environment within healthcare as well.
And for the people that may not be aware or knowledgeable in this area, what is food as medicine or functional medicine? What's the general definition there?
So there's loads, as there is with all new movements, there's so many different religions and camps. You've got integrative medicine, you've got lifestyle medicine, you've got functional medicine, holistic healthcare. I just refer to it really as preventative healthcare and proactive healthcare. And for me, it's looking at the person as a whole, taking in mind their cultural context, their socioeconomic context, and all these social determinants of health, which we know hugely play into behaviors and lifestyles. And then looking at where they're at in their cycle of change. Are they actually ready for change? Or are they in the pre-contemplation stage? And then bearing in mind where they are at, then using motivational interviewing and health coaching techniques to gently nudge them to think about what's their sleep hygiene like, what's their stress management like, what's their overall dietary pattern like. So I like to think about an overall dietary pattern rather than a daily what do you eat for breakfast, lunch and dinner, because I find that can sometimes become a bit obsessive, and people can then sometimes be predisposed to disordered eating when they track too much. So I try get the overall picture. And then what do you do to make yourself feel energized and invigorated from a creativity point of view, and then from a movement point of view. And so really holistically looking at the person and then recommending things within the context of their life. So for instance, London's very multicultural. I'm not going to tell one of my Somali patients to eat a Mediterranean style diet, because what is a Mediterranean style diet to them if they've never cooked with the olive oils and the different types of nuts and seeds that are akin to the Mediterranean diet? You have to make it match up to where that person is coming from.
You're very specified to what the person's needs are and where they're coming from, and their cultural background, which is so crucial and so lacking in traditional medicine. Dr. Jaffee, how long have you been a junior doctor, and what does that entail?
So I've been a junior doctor for 2 years. It's a very strange term that we have here in the UK, and something I do hope changes. Everyone who has graduated from medical school as a doctor, up until you're a GP, so in family medicine, or you're a consultant in any other specialty, so AKA attending, which is the word you use in the States, you are considered a junior doctor. So a junior doctor can be a clinician who's worked for 15 years postgraduate and hasn't become an attending or consultant just yet, and is referred to as a junior doctor. So it's a bit of a strange term. However, I'm a junior doctor. We went on strike last week. It's a very tumultuous time here in the UK at the moment. There's been 3 rounds of strikes because we're a socialist healthcare system, meaning that healthcare is free for all. And that means that the government pays for our salaries. So unlike in the States, where there's privatized healthcare as well as state healthcare, and the government funds our salary, and it's very complex. But we have this beautiful thing, the NHS, which means everyone gets free healthcare. But at the moment, the people working in it are really suffering. So I've practiced as a junior doctor for 2 years. What you do, unlike the States, is in the UK, you rotate around specialties every 4 months over a 2-year period called the foundation program. Whereas as far as I know from friends who practice in the States, as soon as you finish medical school, which you do post-grad, which is different to in the UK, we have undergrad medical school. In the States, you match to the specialty you want to practice in. And if you get that matching, I know it's very competitive, you go off and you become an OBGYN, a family medicine doctor. Whereas in the UK, for 2 years, you rank what jobs you want, and then you do 6 jobs over the 2 years. And so, for instance, for me, I've worked in stroke medicine, geriatrics, so elderly medicine, surgery, psychiatry, and acute medicine and A&E. So a whole array. And I'm about to start a whole stretch of night shifts from next week, which will be fun and games, but it's all part of it.
I should just call you a doctor, because you're doing so many things. But it's incredible. Okay, Dr. Jaffee, Ali, I have a question for you, a bit of a more personal question. How is your mental health today, right now?
So Yeah, it's a good question, and something I've definitely been asking myself all day. So I'd say I've had a really hectic last few days, and I'm definitely in that kind of place of being a bit too run down for my liking, and knowing that I need to, from tomorrow, I have the day off tomorrow, really do something for myself. I've just got back from a family wedding, and then I was lucky enough to attend Royal Ascot yesterday, which is a big racehorsing event just outside of London. And I actually attended with the most amazing mental health startup, which I'm doing some work with. So it was a really wonderful gathering of connection. But you know, you can have too much of a good thing, and I definitely know that my mental health is in need of recuperation, which I'll be doing tonight with an early night, and waking up tomorrow and getting back into routine. So I've been a bit out of routine for the last week or so, but
you're well
I'm well
getting back into the
overall.
routine, and that's incredible. You know,
How are you, Kev?
I will
How's
say this,
here?
and I'm going to be very frank with the audience, because I have struggled with food a long time in my life. I definitely lived with disordered eating for some time in high school as a high school wrestler. Lived with eating disorders, bulimia, anorexia back then. Had that come back around in 2018 after I developed second-degree burns from head to toe because of the medication I was on. That caused massive amounts of inflammation in my system and autoimmune disease to occur. And it changed me forever, in the sense that because of the medication I'm on, it directly affects the way food affects my system. So I don't know if you noticed, but my eyes are a bit red around. Look like I'm a little bit of a raccoon here. And that's because, I'll be very honest, a week ago, indulged in a massive cherry pie that I ate in 2 days by myself, filled with gluten and dairy, and my system doesn't like those things. My system really hates them, and this is what you get. So to be very frank, you know, I deal with those kinds of things, and sometimes I would call it overeating sometimes and things like that. And I have to be very cognizant of this. And so I'm coming back from that. It was a lot worse this last week, and it's gotten a lot better since I've removed it from my system over the last few days. But I've just something I have to be aware of. I think the way you think, in the sense that we talked about this when we first met, I don't like restrictive eating. I'm able to eat the things I love, but also have a balanced food intake. You know, I'm still finding that balance, to be very honest with you. So working through that, but otherwise mentally doing well, feeling good in that space, feeling sane and hopeful for the days to come.
That's wonderful. No, thank you for sharing. I think our relationship with food is something that is just always a work in progress, especially when you've had experience of disorders eating. It's always kind of there and lingering, and you just turn the volume down on some days, and some days you have days where the volume is so high and it's all you can think about. But no, I had, when I experienced anxiety at medical school, the best way I found to deal with my anxiety in terms of a negative coping mechanism was emotional eating. And it was just the craziest experience, because I'd never had an issue with food until my anxiety had started, and that was the only way I could cope. It would just literally calm me down, and it was crazy. And I remember my mom seeing me. She hadn't seen me in like 8 months, because it started when I was traveling before I went to medical school, and she actually thought I was pregnant when she first saw me, because of just how much weight I'd put on from emotional eating and using that as a coping mechanism. And now I'm really grateful that I have a very, as I would consider, stable relationship with food. But I definitely can relate to having off days and using it as a crutch 100%. And I have a huge sweet tooth, so cakes are, I can relate to you on that cherry pie thing. Cakes are my everything. I'm not really like savory.
There's a cherry pie store here where I live, or a pie store. All they do is pie, and I just have to rein it in, Allie. Okay, so let me ask you this: what, during your daily activities and your daily routine, what do you do to take care of your mental and brain health every day? What are your go-tos?
Yeah, so Great question. And I've actually managed to really frame this quite well now after a book that I've recently read by an American psychiatrist called Dr. Pooja Lakshman. And she's phenomenal. And I highly recommend connecting with her. And she talks about a concept of real self-care and faux self-care. And I think so much of the time when I listen to podcasts or consume content around well-being and wellness, people talk about self-care in a very superficial way. Like, for me, self-care is having a hot bath. For me, self-care is putting on a face mask or making a banana cake or whatever. And you know, these are all great practices for people. Everyone's going to be different in what actually helps them, but they only put a band-aid on the problem. They're not actually helping with the crunks of your mind and disordered thinking and negative feedback loops. And so what she talks about in terms of real self-care is actually understanding your own thought processes and your own psychology. And I would honestly say that that is the thing I practice most every day, is recognizing, I call it the 3 R's, is recognizing when I'm going into kind of false logic around conditional thinking, like if I don't get this many likes on the post, or if I don't earn this amount of money, I won't be happy, or blah, 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 all this conditional thinking. And I just think to myself, okay, 3 R's, reflect, recognize, well, actually 4 R's, reflect, recognize, reframe, and then redistribute that energy, because it's a wasted energy if it's all in that negative circle. And that's my main self-care, is actually checking in with myself and doing that exercise. I eat very well. Sleep is so important to me, something I never ever prioritized when I was in my early 20s or my teen years. I was a complete night owl and obsessed with just, oh my God, binging TV and reading until God knows what time, and just over consuming information and never allowing myself to sleep. So sleep is really important to me. Moving my body and walking in green space, especially with my dog, essential for me. Connecting with people, you know, you and I are big connectors. It's something that fully feeds my soul. And creative outlets for stress management. So all of those, I'd say, around the lifestyle and what you can actually do. But you have to think that this stuff is not always available to you. So if you're able to rejig your thoughts and check in with yourself, that's my biggest bit of self-care.
So important to recognize the kind of faux self-care versus literal changing of the brain, changing the mind. It reminds me of Dr. Daniel Amen's Change Your Brain, Change Your Life, and what you can, and also that book, but also the book by Dr. Lisa Firestone and Dr. Robert Firestone, a father and daughter therapist team, called Conquering Your Inner Critical Voice. I read that book so many years ago, and it's a bit academic, but it's very real, based on, and there's been so many additions to the book, but how you can take your self-loathing, your negative self-thoughts, your intrusive self-thoughts, and reverse them over time to be, it's not so much about positivity as it is about turning your truth upside down and making yourself understand that there's a better you out there. But if you continuously say in the mirror that you're dumb, ugly, fat, useless, worthless, how are you going to feel? You're going to feel all those things. That's going to be your truth. Now, I always say, what we recite, what we repeat, that is what we will believe. And if you think of every major faith in the world, what are they based upon? Reciting a prayer, repeating a prayer, believing said prayer. It becomes scientific, and the brain changes based upon how you speak to yourself. And I think people who go through this kind of brain pain have to recognize that their self-hatred didn't come from them. They weren't born self-hating. It comes from every hateful, spiteful, negative, hurtful, mean thing ever said or done to them. As children growing up, we backbrain that stuff. It sticks in our minds, and then when we're having a hard time, we internalize that pain and we switch it on ourselves. So you have to recite hopeful, positive, beautiful, loving, caring, empathetic, and compassionate things about yourself so you can be your best self. And I think that's very important. Yeah.
I want that above my bed and in my mirror in the bathrooms every day. That was so beautiful, Kev. Thank you for sharing that. And can you tell us a little bit, because you've told me about it before, about this term brain pain and why you find that a useful kind of metaphor to describe what you're feeling?
Absolutely. I go back and forth between mental and brain pain. Mental is just so common, and it's something we've been saying for so many years: mental health, mental well-being. but I think that term is vastly outdated. There is a negative connotation to the term mental all by itself. Who in their right mind watching right now, raise your hand if you would love to be labeled mental for the rest of your life. The answer is nobody is going to raise their hands unless they're being silly. So let's call it what it is. Your brain is an organ, just like every other organ in the body. Arguably, it's the most important one. It's physiologically and physically connected to every other organ in the body. It's a symbiotic relationship. Your gut affects your brain health. The things you eat affect your brain's well-being. I call it brain pain because if you look at the brain as tangible, instead of something that, isn't real, like when you think about it like this, when you have liver, heart, lung, or kidney disease, or a cancer of any other organ past your neck down, everybody comes to the hospital with flowers and teddy bears and cake and maybe not cake, but cards and love and empathy and compassion and care. But who shows up for you the first time you end up in a psychiatric ward? Hardly anybody, because they cannot see it, so it must not be real. Your brain pain, your mental struggle is completely invalidated by some of the people who love you the most because they can't see it. And I think that that's how I want to describe it, is this brain struggle, because the brain is an organ just like every other organ in the body, and it too can become diseased.
No, very well put. Very well put. Honestly, I think that's a really, really useful metaphor.
I think it just puts it into a different perspective in my mind. At least that's how I see it. But so you do all these things to take care of your brain health. Let me ask you another personal question, Doc. What or who matters most to you in your life today?
So I guess what matters most to me is that every day at the moment, I'm saying to myself that you can't be everything to the world and nothing to yourself. And what matters most to me is that I stay well and stay grounded. So I say that to myself every day because I have such an insatiable appetite to continue to create and be part of amazing like-minded communities, and I really do need to realize that I need to put the brakes on. So I say that's very important to me, especially at this moment in time, as I'm constantly trying to create boundaries with myself and with opportunities that come through. And then what matters most to me is definitely my family and my boyfriend 100%, and my friends, because I genuinely am so lucky and so grateful to have such a strong support network. I'm incredibly close to both my parents. They've been by my side for everything, and even when we have disagreements around perceptions of mental health and like the generational gap, like we still always get to a common and compassionate understanding. So honestly, really grateful for my support network, because I definitely wouldn't be able to do everything that I do without them. Like sometimes when I'm really struggling to balance everything, my mum will make me my food for my night shifts, and like she's an amazing cook, so I'm super grateful to her and for just being kind of
grateful for those around us who give us strength, hope, and resilience. Beautiful, Doc. I love that. Tell us a little bit quickly about your poetry and artistic ability, because I've seen some of the poems that you've filmed, and they're incredible. And like, what gets you into that artistic mode when you do find that time?
Yeah, no. For me, I honestly get most energized when I'm being creative, and I think it's such a powerful vehicle for self-expression, and we can see it so clearly with so many artists, from Van Gogh to gosh, I can't think of other examples, there's so many out there, Sylvia Plath, all these great artists, they all had these huge struggles, and they used the medium of their work to express themselves, and it was a huge safety boat for them. So for me, I really feel like when I speak to my patients, when I speak to family and friends struggling, I always say, get it out on paper, just even if it's not to be read by anyone else, so it doesn't have to be in an art form, but brain dumping is so important, so it doesn't ruminate around in your head, because we know that rumination is the fuel for our negative thought patterns to continue and continue. So if you can stop that rumination, it's a powerful thing. And I use poetry to essentially help with that rumination. When I start thinking about, like, when I'm having low self-worth or hopelessness, I just start writing, and it kind of just breaks that cycle, and I manage to produce something that I find incredibly moving, and others do too. And from kind of, I see this message all the time. I create a message out of my mess, and I think that that is a really powerful thing, and why I really love writing
message
poetry.
out of your mess, and it's definitely a form of art therapy. I mean, I find myself, I love writing poetry, and I love sketching. I sketch all the time. I stopped for a long time when I was really depressed, and I just kind of kicked it back into gear. And it absolutely, when you get what's inside you out on canvas or paper or pen, or journaling, it really helps you express yourself, but it also gives you a sense of relief. That stress wipes off your shoulders, and you feel a relief because you've gotten what's in your brain out onto the canvas, which is incredible. Okay, Doc, when you feel, or you or your colleagues feel burnt out, stressed at work, as a doctor, what do you do to augment the state you're in?
So I think it's really personal, and I think one of the issues at the moment with mental health in the workplace within the NHS is you don't really have the space to talk about what you do. So I actually can really only talk for myself, and I guess I have the conversation with a few close friends here and there, but we don't really have that same psychological safety and space to reflect in like they do in corporates. And so for me personally, I think it can be really challenging when you're going from one thing to another of heavy content. And what I mean by that, you're going from one like cardiac crash call to an end of life patient, and it can be really emotionally draining. So I do just make sure that in those times I am thinking in my head about, it's hard to explain what I do, but you kind of do detach, but you also think about how important it is to stay in the moment and be emotionally engaged for those patients, and to look after yourself afterwards. So I'll talk to a friend or a family member if I feel like something has been quite troubling, or you do have supervisors you can talk to, but I prefer to kind of keep it more in-house with my support network. And then I think for me, sleep is such an important one, because I find myself becoming much more emotionally vulnerable and sensitive when I haven't had a good night's sleep. And so that's an essential one for me, and making sure that I'm well nourished, because you need your brain to obviously be resilient. And if you're working on your feet all night, long shifts, and seeing quite grueling and harrowing things, you really need to have your brain as nourished as possible to allow you to cope. And yeah, it's quite a tricky one. I'd say it just happens. I've kind of got automatic practices that just come into play, and if you do like, there have been situations where I have found it really hard, and if you do break down, you just have to accept that and say you're only human, and have that self-compassion to say it doesn't matter that I've shown vulnerability to my patients or my colleagues, because at the end of the day, I truly believe that vulnerability is strength, and we can learn from our leaders if they're vulnerable towards us and share their struggles with us, and we don't have that huge divide. And I don't think that vulnerability leads to poor performance or leads to weakness. I really think it enhances it, and I've seen that quite a lot with all within reason and with boundaries and context, but I have seen that it has been really powerful.
Agree. I was in the middle of a keynote for the U.S. military here. I think I was in Texas, and the officers were reluctant to open up, and I asked the commanding officer, he was a general, if he would consider sharing his story, because he had privately shared with me that he had suicidal ideation and needed help, and they didn't just fire him, they gave him the help he needed, and then he worked his way up the ladder, and now he's something like a 2-star general, which is an incredible achievement. Well, he came down and paused and opened up before his officers and told his truth. It had a tremendous impact on their ability to open up afterward and tell their truth, and everybody was the better for it. So whether it's doctors at the NHS,
So
powerful
powerful,
leaders,
honestly.
for the people up
That
here.
respect is,
Yeah, please.
yeah. And I know you know, obviously now, through the power
Yeah,
of connection, the wonderful Rob Stevenson, and this is exactly the work that he's doing. He's, for everyone who doesn't know, he's a gentleman in the UK who has lived experience of bipolar and is absolutely passionate about making corporate well-being and corporate structural change to the better of employees' health. And he has started a whole movement around corporate leaders talking about their own struggles and their personal lived experience of illness within themselves or with their family members and the impact that's had on them, and creating that opportunity of openness, authenticity and connection where everyone can learn and share from each other within, you know, a safe space, has been incredibly powerful for performance from employees and from their well-being. So I think it's wonderful that you managed to activate that within that military scenario, because I can imagine there must be so much stigma around strength and weakness
you're
within that
so
world.
correct, and there is so much stigma and discrimination in that world, and certainly in the NHS world. I think to myself about, and by the way, let's just put the plug down right now. On the 23rd, in just a couple of days, the great Rob Stevenson, who you introduced me to, thank you, by the way, will be joining us second IG Live at 10 a.m. Eastern Standard Time. Don't ask me what that is, GMT. I don't even know. But okay, well, you better. We'll put it on this,
Yes.
on the promo. But Rob Stevenson will be joining us for IG Live 10 a.m. EST on the 23rd, which is in just a couple of days. So excited for that. But thank you for that introduction. I did want to ask you a couple more questions before we wrap this up. How important do you think it is for the NHS to find ways to humanize the workplace? And what is the role of empathy for doctors like yourself play in you and your colleagues' success?
Wow, what an intriguing question. So, breaking it down, I think what is essential for a productive workplace environment is an environment where the onus isn't on you to just be in charge of your well-being. So I think you really need to have that bottom up and top down approach of top down, there are actual policies in place for 24/7 access to food. So that's literally only just come into legislation about a few months ago with a working group that I'm a part of in the NHS England Hospital Food Committee, and only 3 months ago has it come into play that there's 24/7 access to food for hospital staff when they're on night shifts. Otherwise they just have to rely on vending machines, because obviously the canteens are closing that. So if that's not mind-blowing, I don't know what is. So I believe it really needs to come from top down and bottom up. So top down, you want to have all the right things for people to stay well nourished, so food and water that's accessible. And then I think sleep pods would be amazing. I know some hospitals in the States do that. We do not have that. You kind of sleep wherever you can for a couple hours until your bleep goes off, if you can sleep. And then I think, imagine how amazing it would be if there were hospital gym facilities you could use, but they're none of these things that you would imagine a corporate has for employee well-being. It's just not a thing. And I absolutely love the NHS, but this is just the reality, that there aren't these amenities because of a lack of resources and a lack of kind of a lack of value towards the staff, and the fact that we're not robots, we're humans, and there's a person behind who needs to be nourished and cared for. So I think from a systems approach, 100% more needs to be done. And I think there's a lot of work being done by this wonderful psychiatrist I'm connected to, who's trying to create a kind of buddy system, a peer-to-peer kind of relationship that you can have with someone at a similar stage to you in training, that you can talk to about your struggles. Because actually there is this huge divide between your supervisor for pastoral support and you, because all of them are consultants and they actually don't really have their finger on the pulse anymore. They don't really know what it's like to be a trainee, because it's been so long since they were in that training position. So that relationship doesn't really work. A lot of my friends have had great interactions with their supervisors when they've needed help, compassionate leave, etc. But actually, they're too far apart from what we're going through on the ground. So a buddy system that's safe, and getting mental health first aid training and all that kind of thing, I think would be really powerful. And then I think it's important to lead by example for our patients, but only if we have access to those resources. So of course, I think we should have more opportunity for good quality food and good quality lifestyle measures within our hospital, and then also have those practices when we're not at work, but obviously 80/20, all a bit of moderation. And I think reflective spaces are so important. So having a place where you can talk about what's going through what's going through your mind in your working week, if you've had difficult patient scenarios, etc., etc. And there are these things called Balint groups and Schwartz rounds, which have great evidence base behind them, and only specific specialties tend to use them. So what we're seeing is just a lot of patchy initiatives around healthcare, workforce, mental health, and nothing standardized across the board. And it's really quite siloed off depending on where you work in the country, and it's really challenging. And the statistic is terrible, absolutely terrible. A doctor dies by suicide every 3 weeks in the UK, and it is the most heartbreaking thing to just hear the stories, understand the context, and think about the fallout of the colleagues and the families and everything. And yeah, it's a bit of a mess, and I really hope that we are getting to a place where people feel more comfortable around the discrimination aspect and feel comfortable talking about their health problems, whether that's physical or mental or whatever disability they may have. Because unfortunately, healthcare, despite looking after people, hasn't been the most accepting place for workforce to have problems. And it comes down to the slogan, there's a person behind the profession. And yeah, I could go on and on about this. There's change, slow moving change on the way, but a lot more needs to be done structurally. And then,
Dr. Jaffee, your work is incredible. Your effort is palpable and visceral, and you really are challenging the system, which is really something wonderful to see. We're all in America rooting for you, rooting for the success of you and your colleagues to get more. Mental health is health, and if we can be there for the brain and mental health of the people that are saving lives physically, what the heck are we doing? And so one of the things that struck me is the litany of things you broke down that could be done to change the system. And I can't wait to see. I hope there's a book on the way, because it would change the world, Doc. So
you're too kind, Kevin. Just thank you for always, and as always, I learned so much from you, and we really are kindred spirits. So wonderful to chat as always. I'm not sure if anyone has any questions.
If anybody might have a question for Dr. Jaffee, that'd be wonderful. We'd love to hear them. I'm going to go back here and just see if I missed anything. Let's.
I have kept an eye on it. I don't think there've been any questions, but if anyone has any questions, you're welcome to contact me. I'm active on my Instagram here and my LinkedIn. And just thank you so much for having me. Great chat.
Be well, be here tomorrow, every day after that. We care about you. We're here for you, whatever you need. And to everybody listening and watching, go forth, take care of your brain health, take care of yourself, be kind and compassionate to yourself, and be here tomorrow. We'll see you. Bye.
Bye, everyone.